Hi everyone, we're back here at the anatomage table and today we're going to cover the reproductive system. The reproductive system is primarily responsible for the production of offspring. Although the male and the female reproductive system are quite distinctly different, it's by these two coming together that fuses and produces the offspring. So we're going to begin with the male reproductive system, and that consists of organs whose functions are to produce, transfer and ultimately introduce mature sperm into the female reproductive tract where fertilisation occurs. So this is the scrotum. Within the scrotum, the testes are located, and we'll look at those in more detail shortly. There are muscles located just under the skin of the scrotum, and they contract and pull the testes upward against the perineum. Sexual arousal and cold cause these muscles to contract. When it's warm though, the testes descend, and this is to keep the sperm cooler. The constant temperature is important for optimum sperm production within the testes. So we're going to have a deeper look now inside. So you can see a closer up view of the testes here, and they're suspended in the scrotal pouch by attachment to scrotal tissue and also by these spermatic cords. The left testes is generally about 1 centimetre lower in the scrotal sac than the right. The testes have two main functions. They are to produce sperm and to secrete testosterone. That's a hormone that's responsible for male characteristics. Okay, so we're now going to have a look at the epididymis. This is this whitened area here, and it is actually a really tightly coiled tube that's enclosed in a fibrous casing. It measures about 6 metres long, and it lies along the top and also in behind the testes. The sperm matures, it's produced from the testes, and then it passes through the epididymis. The sperm can actually spend about 1 to 3 weeks within this tube, and it does secrete some of the seminal fluid as well. You can now see the spermatic cord. We've coloured it in green. That's a structure that connects the epididymis to the ejaculatory duct, this large duct here. It's got muscular layers that help propel the sperm through the ductal system. You can see also the little ejaculatory ducts here in pink. They actually pass through the prostate gland. You can see the prostate gland here in the background, and they terminate in the urethra. The seminal vesicles are pouches that secrete fluid. You can see them here, yellow, and that makes up about 60% of the overall semen volume. We're now going to cover the penis in a little more depth. So the penis has erectile tissues that are enclosed in separate fibrous coverings, and they're held together by the covering of the skin. One of the tissues is the corpora cavernosa, and the other is the corpus spongiosum, and inside that lies the urethra. During sexual arousal, the erectile tissue of the penis fills with blood, and that causes the organ to become rigid and enlarge in both diameter and in length. That erection permits the penis to serve as a penetrating organ during sexual intercourse. The glans penis is this bulging structure at the end of the penis. Skin is folded doubly to form a more or less loose-fitting retractable casing known as the prepuce or foreskin. We'll now have a different view of that. Julie, can you explain why this applies in nursing?
Yes, Anne. As you can see from this picture, there is skin covering a section of the glans penis. Surgical removal of the foreskin is called circumcision. In the past, this was quite a routine procedure on infants, and it was done because it was thought to cause penile cancers and urinary tract infection. However, there is no evidence to support these beliefs. Today, in this day and age, the decision is left to parents to decide whether to remove the foreskin, and usually it's done because of religious or cultural beliefs.
Okay, so now we're going to go back into that deeper vision again. we're going to just talk about the urethra. You can see the urethra here, and in males that has two functions. It's both for urine to pass through and for the ejaculation of semen. You can see here the prostate gland again, that lies just below the bladder. The urethra actually passes through the centre of the prostate and it secretes fluid, and that also makes about 30% of the seminal fluid volume. During ejaculation, the prostate gland squeezes the semen through the urethra. Now, Julie, can you just talk a little bit about why, as nurses, we need to know about that prostate gland?
Yes, Anne. Often in older men, there is a non-cancerous enlargement of the prostate gland, and it's referred to as benign prostatic hypertrophy. The problem with this is as the gland enlarges, it actually squeezes on the urethra, and it causes a significant amount of pressure, which can give the patient urinary tract infections, and also it almost makes it impossible for the patient to pass urine.
So you can see these little red structures here. They're called the bulbourethral glands. They're about the size of peas and they're located at the base of the penis. They secrete an alkaline fluid that reduces the acidity in the female vagina, and they secrete mucus to lubricate and protect sperm from friction damage during ejaculation as the sperm pass through the urethra. So now we're going to have a look at the external anatomy of the female. So you can see here this mound is the mons pubis. The function of that is just to protect the genitalia. On the outside is folds of skin called the labia majora, and that just protects these internal structures. You can see here the labia minora. During sexual stimulation, the blood vessels in the labia minora become engorged with blood, and that causes the labia minora to swell and become more sensitive to stimulation. You can see here as well the clitoris. That's actually composed of erectile tissue, and it becomes erect during sexual stimulation. It's got a large number of sensory receptors that feed back information to the sexual response areas of the brain. And here is the opening of the vagina. So we're now going to have a deeper look inside. Okay, so you can see these internal structures opening up, and now we're going to take another view. So you can see these white structures here, which are the ovaries. The ovaries secrete the hormones estrogen and progesterone, and they're responsible for our female characteristics. They also secrete the eggs, or the ova. So when that egg is secreted, it's passed out into the fallopian tubes, these yellow structures. It may be that the ova meets up with the sperm here in the fallopian tube, and this is where fertilization occurs. The egg and the sperm, or the egg if it's not fertilized, travels down into the uterus. If it has become fertilized, it embeds into the inner layer of the uterus called the endometrium. If the egg is never fertilized, it actually passes out during menstruation or when a woman has her period and blood passes out down through the vagina. So looking more closely now at the uterus, you can see the body of the uterus and the neck of the uterus. At the neck of the uterus is a structure called the cervix, and that connects the vagina with the uterus. The vagina is a collapsible tube, and it's capable of great distension. It's composed mostly of smooth muscle, and it's lined with mucous membrane arranged in folds called rugae. Do you remember that from the digestive system? We talked about folds called rugae then as well. During intercourse, the lining of the vagina lubricates and stimulates the glans penis, which in turn triggers the ejaculation of semen. The vagina also serves as a receptacle for semen, where it climbs along fibrous strands of mucus into the cervical canal. The vagina also serves as the lower portion of the birth canal, and it transports the blood and that tissue shed during menstruation. So we're now going to have a look at the female breasts. So you can see here pictures of the breast, and this one we've gone deeper in. So the breast lies over the pectoral muscles and they're attached by some connective tissue. Each breast contains lobules, and these lobules have secreting cells that form milk. These converge towards the nipple, and where they terminate in a tiny opening on the surface of the nipple. So there are lots of little openings here on the nipple that secrete the milk. The nipples are bordered by this pigmented area called the areola. The function of the breasts is for lactation, the secretion of milk for newborn infants. So that concludes our presentation of both the female and the male reproductive system. So thank you for your time and attention.